Hi, my name is Manuel Loja. My topic is renal complication of hematopoietic cell transplantation. Definition: hematopoietic stem cell transplantation will offer curative potential in the treatment of both malignant and non-malignant disorders of lymphohematopoiesis.
That's another important issue because we know now that renal complications are very frequent in the patient that receive a bone marrow transplantation. We can say that probably allogeneic bone marrow transplantation is a cause of chronic kidney disease. And in this study, we were able to test the hypothesis talking about the frequency of acute kidney injury in this context and the frequency of chronic kidney disease in this context. In our study, unfortunately, we don't have a link between acute kidney injury and chronic kidney disease, probably because patients that have very severe acute kidney injury have terrible prognosis, and many of them didn't survive. But an important conclusion of our study was that patients without any alteration in renal function before transplantation had or present during the evolution of the transplantation chronic kidney disease. And of course, this is a group of very, very, very young patients. And this is a very complicated, accurate complications and accumulate morbidity for those patients. So this is important conclusion. We need to work and try to predict the risk of chronic kidney disease before transplantations in order to avoid complications and improve survival in these patients.
There are more than 20,000 people waiting for a liver transplant alone in the United States, yet there's only about 5,000 to 6,000 liver transplants that are performed every year.
At Einstein and Montefiore, we are developing insights using cell culture systems to understand what could be done to transplant cells rather than organs, and how those cells can in fact cure diseases.
Montefiore has more than a 40-year history in transplantation, and now with our new cell transplant and stem cell effort, we hope that we can carry this innovation to the next decade.
Application in medicine. It has been associated with the development of both acute and chronic kidney failure. HSCT remains a very important cause of morbidity and mortality peri-transplant. Acute renal failure ARF is common and costly, and ARF requiring dialysis and associated with extraordinarily high mortality. Pros and cons. It is great cure for lymphangiomatopoiesis because of this effectiveness. The percentage of renal failure is high. Chronic kidney disease occurs in 20% of cases.
One of the improvements I can see right now immediately is there's better coloration in my face in just a few days. As far as the kidney function, I won't know until the cells do their work for a month or 2 to 3 months. But I've seen coloration and I feel good. Well, I haven't had no treatments before I come here. I went to the VA, I go to the VA Medical, I'm a veteran, and they told me that my kidneys were down to 29%. And in 5-10 years, I might have to go on dialysis. So I thought I got to do something about it. And I asked the doctor there, I said, what about stem cells? She didn't know too much. She says, when the time comes, we'll look at putting you on dialysis and put you on a list for a kidney. And I didn't want that. I heard a little bit about it. I researched on the internet about it. And then I started calling. I called a few places here in Thailand. And then I got a hold of Faith, but through the internet, and she let me talk to the doctor. I talked to a couple other doctors, but when I talked to the doctor here, I can't remember his name, I'm bad at names, but he seemed very intelligent, and I'm a pretty good judge of character, and he knew what he was talking about, so I felt comfortable. This facility is phenomenal. They keep it clean. There's plenty of staff. The rooms are nice. I don't have no complaints. If I have it, there's more personal care. You know what I'm saying? More personal care. So if I had something major wrong with me, I'd rather come over here and have that problem taken care of than go to a local hospital back home where you're just another number. Everybody was professional. Everybody did a good job. So I have no complaints at all there. I'd tell him to get a hold of it and talk to Dr. Nassar. Talk to him, let him know. I had to send my blood work. I had to send everything over here before, and he studied it. And he can study your condition. And when you're spending money on yourself, you're never wasting it. Because if you let your condition go, you can't take nothing with you. It was a positive experience.
Issue apply in Ecuador. Here in Ecuador, the steps of transplantation but have well kidney failure persisted performed in this case.
Stem cell research does show promise in a lot of areas, especially in transplantation. And if you look at sort of the whole of regenerative medicine with stem cells, they tend to be best applied in situations where you just need the function of a certain cell type, whether it's the islet cell in the pancreas or whether it's a liver cell. The kidney contains a lot of very widely diverse cell types, and so it's difficult to look at stem cells as replacing kidney function, but potentially possible.
In conclusion, acute renal failure ARF is a common complication after hematopoietic cell transplantation that occurs in the first 3 months after transplantation and increases the risk of mortality and future chronic renal failure. There is no specific treatment for BEO OH, but its management includes careful management of fluid overload, kidney dysfunction, and other complications. Thank you very much.